Prisoners. No one want to get up on the road for their bread. Why? Cannot get up every day and depend on the same man. Look here.
Ladies and gentlemen, my name is Paul McKeever. I'm a lawyer. I've been for 10 years. I graduated right here at the University of Western Ontario Law after doing a few years of graduate school, right there in the Social Studies department, psychology. I'm also the leader of the party, and I'm running in London West. Now, in 2003, the McGuinty Liberals said they needed to raise $2.3 million, $2.6 billion, by imposing this new tax. And you would think that having already violated the promise not to raise your taxes, that you'd actually now have a system that was good, maybe even excellent, because they set the dollar figure. This is the amount they needed. Where's the performance? I don't see it. Last October, I sat by my brother, who was literally, I would say, hours from death, having waited in bed for an entire week. He was supposed to have gone in for surgery, life-saving surgery, on a Thursday, but could not do so because of a motorcycle accident. The accident, the person who was harmed, had to spend the next 24 hours in the only operating room that was open at St. Michael's Hospital in Toronto. When the orderlies came to pick up my brother, it took too long. The nurses said, "Get rid of the gurney, let's just take the whole bed." They ran him right into the operating room, and they later told us, you know why we did it? Because it was first come, first served, and if we didn't get your brother in there, he would have been waiting again. Unacceptable. We're not getting what we're paying for.
Let's start with poverty. Poor people are sick people, and sick people are poor people. And so when we Democrats talk about reducing poverty and increasing the minimum wage to $10 an hour, we're talking about the health of Ontarians. When we talk about fighting for affordable housing, we're talking about the health of Ontarians. And when we talk about making sure that we have good jobs with good benefits, we're talking about the health of Ontarians. Also our environment. When we talk about a right-to-know law that ensures that families know what toxins and other environmental hazards are all around them in their drinking water, in the land, in the air, in the ground. We need to make sure that people have a right to know what's around them, and that's about preventing cancers, long-term health for individuals. But the Democrats have always been committed to a public health system that invests in more doctors and nurses. We do that by creating more training spaces for healthcare providers, to expand the pool of skilled professionals and shorten wait times for patients. It means providing free dental and drug coverage for everyone over 65, and expand the long-term care options for thousands of seniors who are waiting right now for in-acute care hospital beds. It means controlling drug costs, prescription drug strategy to help families afford the medication they need, and phase out the evergreening of patented drugs so cheaper generics are available sooner, saving money for patients and hospitals. It means certifying internationally trained doctors to practice in Ontario, expand home care and guarantee a daily minimum of 3.5 hours of personal care in long-term homes to take the pressure off the hospitals, ERs, and family caregivers. Ensure that every provincial health dollar is invested in public health care, not private hospitals. And those are the commitments that the Democrats bring to the table. And once again, let me reiterate, it's a comprehensive strategy that deals with the environment and poverty as well.
Ladies and gentlemen, the primary difference between the Freedom Party approach to these issues and the approaches you'll hear on the rest of the table here is that whereas the rest of my colleagues or friends here are telling you how they would save the system or strengthen the system, Freedom Party's focus is, instead of saving the system, saving the patient. To do that, we have to make sure that the patient's concerns are the ones that are addressed by healthcare providers, not the concerns of elected politicians who are concerned about defending unions, who are concerned about defending politicos, and etc. That is not the right thing to do to the healthcare system. But right now, the healthcare system is forced, because the government is holding the purse strings, to respond to politicians' concerns first, and if they can still do so, then to respond to the needs of patients. Freedom Party's approach is this. Restore to patients the power of the purse. Give them the power to say, I want to choose OHIP, or I want to choose a private insurer, or I'm young and I'm healthy and I want to pay as I go for now and I'll think about buying health insurance later. I know that sounds very different than what we have. It's in fact what we had before the Progressive Conservatives changed everything in 1968 and banned private insurance and introduced a brand new tax, the provincial income tax, to pay for the OHIP monopoly. We're saying, don't get rid of OHIP, but introduce some competition so that OHIP puts the concerns of the patient first instead of putting the concerns of elected politicians